The Healthcare Labyrinth Podcast is back for another episode. Join Marc S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth Podcast. My name is Marc Ryan, and thanks to everyone for listening in. If my podcasts were not data and statistic-ridden enough, today we are going to have a podcast that likely goes even more mathy than normal. We're going to talk about the 2026 Medicare Advantage enrollment season, the good news, the bad news, and what the numbers really say. We'll take our normal 3 breaks to allow us to consume this a little easier and for me to take my breath every once in a while. So let's jump right into it. Part 1, the sky didn't fall, but the earth shifted. After a long delay, the Centers for Medicare and Medicaid Services, or CMS, finally released the January and February Medicare Advantage enrollment data for 2026, and the industry was bracing for impact. Some analysts predicted contraction. Some said a mass exodus of large plans from markets would gut enrollment. Some projected a 1 million member collapse during open enrollment. That didn't happen. What happened instead? Something far more nuanced and far more telling. Enrollment growth slowed dramatically, but Medicare Advantage did not contract. I predicted flat or historically low growth in 26. That's exactly what we got. Did you hear me patting myself on the back? The relatively flat growth happened despite massive benefit pullbacks, geographic contractions, financial distress across major carriers, plans actively shedding membership. But Medicare Advantage held. Let's ground this in some facts. From February 2025 to February 26, MA grew from 34.941 million to 35.815 million. That's 874,000 lives. That's 2.5% growth. Not the explosive growth of prior years, but not collapse either. From December 25 to February 26, during open enrollment, growth was 115,000 lives, not 1 million in losses, 115,000 member gains. So what does that mean? It means the $500 billion private Medicare alternative is still standing. And more importantly, seniors still see value, despite benefit reductions, despite narrower networks, despite political criticism. Medicare Advantage penetration now stands at 35.815 million members, or 51.5% of all Medicare beneficiaries. That's right, the majority of Medicare beneficiaries continue to be in Medicare Advantage. Some analysts say the penetration is as high as 55%, but my calculations come in closer to 52%. What has happened since 2020? MA has grown almost 50%, 11.9 million lives. MA penetration grew 34% over that time frame. Growth from 2020 through 2024 was stunning. Then came the slowdown, 4.4% growth in 25, 2.5% growth in 26. That's not collapse, but it is retrenchment. And it tells us something critical. The industry is under financial stress, but the value proposition is still powerful in MA. So why does Medicare Advantage still attract enrollment, even when benefits are cut? Let's talk about that after the first break. Be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Marc Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Marc dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Marc is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Marc's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back, and we hope you're enjoying this Healthcare Labyrinth podcast episode. I promised to get into why Medicare beneficiaries still like MA despite some of the cutbacks. So here's part 2, why seniors still choose MA. Medicare Advantage isn't surviving because of inertia. It's surviving because of math and the value people see. MA rate setting is based largely on the antiquated and inefficient fee-for-service system. That inefficiency creates margin for plans to operate more efficiently and return value to members. And those savings are mandated to be passed through. How? Reduce cost sharing, filling massive fee-for-service benefit gaps, covering usually uncovered high inpatient costs at bankrupt seniors, adding supplemental benefits traditional Medicare simply doesn't offer. Add in the STAR program bonuses, which reward high-performing plans with additional revenue, and you get a recipe for even richer benefit package. Meanwhile, traditional fee-for-service Medicare remains transactional and reactive. MA plans provide case management, disease management, coordinated care, and out-of-pocket caps. The result, MA has become one of the largest social safety nets for lower and lower middle income seniors. For many fixed income beneficiaries, MA means hundreds, sometimes thousands in a given year, of dollars in additional annual support. And savvy beneficiaries move toward higher rated plans to capture even more value. That's why the program didn't implode when benefits were trimmed. Now let's break down where the enrollment actually went. So let's get to part 3, the big plans, blood in the water. I analyzed February 25, December 25, and February 26 CMS enrollment spreadsheets. I excluded the January files for 25 and 26 because many analysts, myself included, believe they contain anomalies. Here's what we see. National MA plan enrollment rose from 25.65 million in February 25 to 26.511 million in February 26. That's 861,000 lives, or a 3.35% growth. But here's the twist. From December 25 to February 26, big plans lost 328,000 members, a 1.22% contraction. Big MA share, 73.41% in February 25, 75.18% in December 25, and 74.02% in February 2026. 98.5% of year-over growth occurred in big MA plans, but during enrollment, non-big MA plans added 443,000 lives, while big MA lost 328,000. That's a shift. Let's go carrier by carrier. United Healthcare, the biggest one. United Healthcare was down 555,000 lives year over year, or 5.6%. It was down 938,000 lives from December, or 21%, signaling more contraction ahead. Humana was flat February 25 to December 25, but then Humana added 1.2 million lives during open enrollment. That's massive growth, but investors worry margins may erode because they grew too much in the open enrollment season. CVS Health's Aetna. Aetna was down 131,000 during open enrollment, and it was down 58,000 year over year after huge growth in 2024. Elevance Health. Elevance Health was down 320,000 during open enrollment and down 370,000 year over year. Kaiser Permanente. It was up 23,000 during open enrollment and up 64,000 year over year. Centene was down 83,000 year over year, and 33,000 of that was during open enrollment. Healthcare Service Corporation acquired about 700,000 MA lives from Cigna in early 2025. Therefore, it grew from 236,000 to 978,000 lives after the acquisition. Then it shed about 98,000 lives, or 10%, during open enrollment. Molina Healthcare. It was up 46,000 from February to December and down 30,000 during open enrollment. Now here's where things get interesting. The startups, Alignment Healthcare, Clover Health, and Devoted Health. Collectively, they were up 376,000 year over year, and 340,000 of that was during open enrollment. Devoted alone grew 121% during open enrollment adding 257,000 lives. Clover added 67,000 lives year over year, and Alignment added 54,000 lives year over year. The insurgents are capitalizing, and that should get the attention of the giants. With that, we will take our second break, and when we come back, we will get into growth in products. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back, and we hope you are enjoying this Healthcare Labyrinth podcast episode. I promised to get into some of the growth in products now. So let's get to part 4, SNPs, product shifts, and the real story. Let's first talk special needs plans. This is where MA plans are making investments and the growth numbers show it. SNPs grew 647,000 lives year over year, with 259,000 of that during open enrollment. As of February 2026, there were 6.425 million D-SNP members, which is about 78.4% of SNP enrollees. That's up from 6.324 million, growth of 101,000 or 16%. Chronic care SNPs, they are now at 1.646 million, or 20% of all SNP lives. This is up from 1.108 million, growth of 538,000 or 49%. CMS has already signaled concern about C-SNP growth, particularly dual eligibles migrating into these C-SNPs without D-SNP safeguards. That could change. Institutional SNPs, they were 129,000 lives in February of 2026. That's just 1.6% of all SNP lives. That is up from 122,000. Now let's talk benefit contraction. Plan benefit packages, or what we think of as plans, dropped from 7,127 in February 2025 to 6,918 in February 26. That's down 209 PBPs, about 3%. Sponsors increased slightly to 312, up 4. Now the product story. For years, PPOs surged, especially in rural and suburban markets. But from February 25 to February 26, PPO PBPs dropped from 2,607 to 2,419. That's down 188 or 7.2%. HMO PPPs also dropped, but just 42 or 1%. Enrollment, HMO enrollment grew 937,000 from February 25 to February 26. PPO enrollment dropped 103,000 in that time frame. HMOs are clearly back in control. Why? Well, there are cost pressures. PPOs are more expensive to operate. When margins tighten, flexibility contracts, and therefore you lose PPO offerings. With that, let's take our last break, and when we come back, we will wrap things up with the good news and bad news and a warning. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Marc Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Marc's insights. Twice a week, Marc publishes a blog to go deep into a current issue. And of course, Marc hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Marc's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back, and we hope you are enjoying this Healthcare Labyrinth podcast episode. I promised to sum things up here. Final take, good news, bad news, and a warning. Here's the bottom line. Medicare Advantage did not collapse. It grew to 35.815 million lives. It now covers 51.5% of Medicare beneficiaries. It has grown 11.9 million lives, nearly 50% since 2020. But growth has dramatically slowed. 4.4% in 25, 2.5% in 2026. Big plans are under financial stress. With the exception of Humana, most large carriers shed lives during open enrollment. Non-big MA plans gain ground. Startups surge. SNPs are booming, especially C-SNPs. PBPs contracted. PPOs retrenched. HMOs resurged. Aging demographics, star bonuses, risk adjustment, at least for now, and a structurally outdated fee-for-service system still makes MA attractive long-term. But financial stress is real. Margins matter, and benefit generosity is no longer automatic, as we see from 25 and 26. The 26 season tells us this. Medicare Advantage isn't shrinking, it's recalibrating. And the players who adapt to tighter economics, disciplined benefits, focused geography, smart SNP strategy will define the next chapter. The value proposition still wins, but the easy growth era, that's over. I am Marc Ryan. This is the Healthcare Labyrinth Podcast. Thanks for tuning in. See you next week, and take care.
Thanks for joining Marc and the Healthcare Labyrinth Podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth Podcast.